New at 6, a new partnership is aiming to help pregnant mothers here in the Valley who are carrying babies diagnosed with heart defects. CBS 4's Imelda Mejia has our report.
Now mothers carrying a child with a pre-diagnosed heart defect can see the doctor that will be performing that surgery here in the Valley before traveling miles away to have that heart surgery. Gabby Garcia had her second son, Brandon, 1 month ago. Garcia was 4 months pregnant when her doctors in Roma diagnosed her unborn son with a heart disease.
His left side wasn't growing as it should, like the right side, and we started seeing cardiologists and everything. They didn't think it was a big of a deal.
But as soon as Brandon was born, Garcia and her son were rushed to San Antonio for an open heart surgery because his heart wasn't receiving enough oxygenated blood.
Once they saw him and they diagnosed him, it was really different than what we thought it was going to be. So yeah, it was scary. It was hard.
The doctor's hospital at Renaissance estimates that Gabby is one of about 150 pregnant mothers that need to travel outside the Rio Grande Valley to receive treatment for their child diagnosed with a heart disease. But a new partnership between DHR and the University Hospital in San Antonio is looking to change that.
Very quickly, we could have a clinic here where we would see mothers who are pregnant with babies that have a thought of having heart disease who may need surgery very early in life, as well as patients who we've operated upon so they don't have to travel far away for their post-operative checks.
The new partnership allows Dr. Hussein to travel down from San Antonio once a month to meet with patients in Edinburgh and also speak with local doctors on the status of each patient, something that local doctors say the Valley needs.
There's always has been a huge need for this program because in here in South Texas, even though it's a relatively small community, we have huge prevalence of diabetes and somehow an immense amount of congenital cardiac anomalies.
The partnership is just starting out, but Garcia is glad that she only has to drive 1 hour from Roma to Edinburgh rather than drive 4 hours to San Antonio. At the moment, only pre-surgery evaluations and post-surgery follow-ups will be given here in the Valley, but soon enough that will be followed up by non-invasive surgeries and ultimately open heart surgeries. In Edinburgh, Imelda Mejia, CBS 4 News and ValleyCentral.com.
Health officials say the new partnership will grow as nurses and doctors from San Antonio are going to come down to the Valley to do hands-on training. They will prepare to perform pediatric open heart surgeries here in the Valley.